And next, we will have Debra, and she is representing ppxTEC.
Thank you. Good afternoon. I want to make sure all my gadgets work. In 1989, I was diagnosed. In 1989, that's Tony in the back. I was diagnosed with breast cancer. No advocate and no internet. All I heard was the word cancer associated with my name, and I lost the inability to retain any of the prior conversation. That diagnosis left me with a complicated health history, which means that I always have to have my current health records with me. I know none of you guys have experienced such, but maybe you know somebody who has. ppxTEC users own their complete health histories on their smart device all the time for a lifetime. Silo records plus duplication of tests equal lives and money lost. IBM reports that healthcare data is estimated to double every 73 days by 2025. Market consultants agree about the pain points and problems of data fragmentations and its inefficiencies. We built a bidirectional data exchange. Bridge. I'm trying to get the highlight on it. Data bridge that connects data through hospitals, pharmacy colleges, public health entities, managed care organizations, accountable care organizations, just various healthcare entities, and that data flows seamlessly and in real time through providers, smart devices, and Apple and Google's health platform. All of these entities use different proprietary software. Our tool is hyped on AI, and it's smart on fire. We have a well-built application focused on patient-centric interoperability. This November, our updated iOS and Android app will drop. These are some of the benefits of our app. It aggregates data, which means like an email, it falls down automatically on your smart device. It has a simple UI, it's family focused, meaning mothers can have the information of their children, or caregivers can have the information of the loved one that they're taking care of. It has Bluetooth and NFC technology, and it's fast sharing. And what's so important about that is that out of our device, there are 7 modality share exchanges from one application. The data is shared, AirDrop, Bluetooth cross-platform exchanges. This is text and images without email or data plans. Email, which is HIPAA compliant, print, import and export. Import and export is connected to APIs. I think I got the buttons right, I'm sorry. PPX users own their complete health history. So that means you say goodbye to the hassle of repeated paperwork, partial portal downloads, and missed history information when you need it. I lied. This sets us up for many business opportunities in the healthcare market. Our initial focus into the business and revenue market is passive remote patient monitoring using the smartwatch, what I have on. In 2020, it was guesstimated that $822 million was spent in that market, and it's also guesstimated that $1.8 billion will be spent by 2028. CMS and commercial insurances have reimbursement codes that pay for remote patient monitoring. Our solution, PPX, promotes compliant reimbursement. There are lots of checks and time commitments to make that equal so that you can build a clean claim. A business model. We have a SAB subscription with remote patient monitoring. Also a SAB subscription with hospitals, managed care organizations, other entities, and the government. SAB subscription with partnerships and alliances such as the ones we're talking to now, the Civil Data Cooperative in the UK, and some folks and representatives from the WHO Coalition. We also have opportunities to make business from third-party licensing, white labeling, general data integration, selling data, or they call it data monetization with patients' consent, selling de-identified data or aggregated data sets, and then charging mass subscription markets for certain countries. Our strategy. I like this green button. I think that's what's been messing me up. Our strategy is to start local and think global. Under remote patient monitoring in 2024, we plan to onboard a pilot, and we're in one conversation with the potential project here. The best thing about the remote patient monitoring market is that the customer type that we're targeting can lead to a second customer in a separate state. And our new app release for the first time is outside of the US. We're releasing it in 6 other different countries, 2 of them because of active conversations going on. 2 of them is because the market doesn't have a health ecosystem that could support, it doesn't have a health ecosystem that support the population, so we think we can drive a subscription-based or a user model. That would be India and New Zealand, and some other markets that we're talking to. PPX was designed for gap mending and companioning legacy systems. We don't have a competition or competitor. We want to fill the gaps in companion systems that are already in the market and where fragmentation continues to be a problem. Wow, okay, this is gonna get me in trouble. Here, our app doesn't store any data for the user. That data stays where it is now, in that API or on that end user's device. And also our app allows for multifamily usage. We found that that's important because other people have to take care of other people, and having receipts for your health data is important. I'm Debra Griffin, and I'm the founder of PPX. This is my health data. It's a compilation of PDFs, disk, and jump drives in 2023. I have over 45 years as a CEO of rural hospitals. Dean Harrison, who is not here, he's my CTO. He has over 30 years in software development. Dr. Katrina Poe is our medical advisor. Our team knows interoperability. Our team knows patient-consumer interoperability. But we do need improvements in business development and sales. Industry insiders, what they say. I'll read those. I have to. Drew from Rapides. I believe PPX can play a role in realizing the concept of a modern, data-rich healthcare system. We support PPX in being among the first to explore the new approach to healthcare data management. Mark from Onyx. The solution facilitates real-world exchanges in a non-threatening manner. Its release aligns perfectly with the current need for fluidity, literacy, data usability. PPX is currently integrated into our clients' live APIs to make introductions to Maryland and the Connecticut Health Information Exchange. Our ask, we have a well-built product. We're looking for a network of people to help us get our app in the hands of users. Thank you. Any questions? Don't have to be any, okay, there we go. Hi.
Is there, when I see this, I think of like drug interactions, is it drug supplements, I'm assuming, everything, every time you change a doctor, all those forms you have to fill out is what you submit there, right?
Yes.
Does it have any kind of AI capabilities with like recognizing potential drug interaction or supplement interaction, like issues that someone wouldn't think of as like a warning to even bring up to their doctor that, hey, I also take this vitamin?
It does. I said a word when I was describing that said it was hyped on AI. That's a word Tony don't like. But the app does have AI integration. It's supported by AI. The apps are being launched. AI has to automate data. It has to analyze data. So once that data flows through that, not only can it do the analytic part, but it also can do the predictive part. There's no problem of having AI function on any data, not just data that I would have. But our hope is to make it more clinical acceptable by having plugins in the AI. So let's say you're going to your cardiologist and you've been to various doctors, then that AI should be able to analyze that information, pull out that information, summarize that information, and present it in a way where the cardiologist can use it, make it usable, but not make it too hard where doctors don't want to be presented with it.
I wanted to ask about the billing codes that you have up there. I guess I was kind of interpreting that as like I go to the hospital, I go to my primary care physician afterwards. That primary care physician doesn't have access to my hospital data, so he can then bill insurance in order to read that. Is that correct?
Totally different. Okay. Basically, the solution helps you to, over time, because there's no central data depository in the United States. It will never be. We've got a hybrid system, public and private. So your doctor only has what he has on you based on whatever EHR vendor he's having. And there's various EHR vendors. They're proprietary vendors, software, and they all don't transfer. They don't talk. They don't communicate. So PPX would be the bridge between the talking and the communicating. But the codes up there was in reference to our first line of business, and that's passive remote patient monitoring. And that you do with providers. If providers wanted to use PPX to do it using smart devices, when I say it helps it promote compliant reimbursement, to do remote patient monitoring, the patient has to have so much time with whatever they're doing. They send them these kits. And then these kits have all of this other information. And then they've got to have like 20 minutes or 30 minutes at this time. If they don't meet all those check marks, then they can't bill for it. But those were the codes where the federal government and commercial insurances will get paid to provide that remote patient monitoring. Because we're so diversible, I messed that word up, but there are different other markets. We're a data management entity in some of those counties, the countries that I showed you. Some of the conversations are they don't have a structured EHR program. So they're interested in maybe having a structured consumer-facing data management program for their population. And then 2 of them I just dropped in there because they're in war. And I want to take advantage of the problems that's going on in these countries where these people are losing their data, don't have access to any of that information, having to leave and having no way to communicate all of the past things that's going on with them. You know, avocation, people who advocate for the health care, those are the people who have better health outcomes. Yes, sir.
How do you mention the data being on the user's device? How do you manage imaging studies?
How I meant the last part.
Imaging studies, like an MRI scan.
Uh,
Those are bulky files.
yeah.
I know she had an optical disc, you had a CD. Where will that image be? Will it be at the imaging center, or will, and the user just has a report, or will the images, how do you manage the images?
The user will have the image, and if you see me afterwards, I will get your information and shoot you some videos of it. I ran out of time. I did have a 1-minute video that kind of showed that, but we're using all of the available technology to make those data exchanges, and it's really neat.
So they can view it on their device.
Exactly, yeah. And they can also do it Bluetooth, because a lot of people, when you're doing population engagement, they don't have data plans like you and I might have on our phone, so they use data cards. So if you really want to include everybody in having an opportunity to have that holistic health history, we went and architected and built a Bluetooth cross-platform that exchanged in proximity text and images that would just flow. Yes, sir. I can't hear up here, I'm sorry.
So you mentioned you should save paperwork and time at the doctor's office. Are you envisioning like being replaced for filling out the initial paperwork? Could you describe that a little more detail?
Well, actually, it would help you facilitate that appointment, and it will also give that information that the doctor needs so that you won't have the clipboard. The only purpose for the clipboard is to make sure that your insurance information is the same, your address is the same, and all of those other things.
Because I asked because that's one of the biggest things that drives me crazy with doctors, is the same things out over and over.
I might have one more question.
So remote patient monitoring is typically something a clinic would reimburse you on, but for patient health records that, you know, bringing it in off of an individual, is that something you would invoice to bill the patient or the person or the user? How would your model work?
For patient health for exchanging data, the apps are free. So there's no monetary value for the masses to use. The monetary value is to make money from entities like managed care companies, where they're doing chronic management, or from other entities, government entities, or like the partnership. They've got to pay so much to keep that person healthy. Our app allows communication both ways and also monitoring.